Greetings, everyone. Thank you for joining today's call hosted by Family Office Insights, the Bavelas Group, and Private Medical. Our presenters today will share a practical approach to dealing with the COVID-19 pandemic. For the purposes of webinar logistics, all parties have been muted except for our presenters. We will reserve time at the end of the presentation for questions. We will be taking those questions in written form, so if you've called in by your phone, you will not be able to ask questions. But for those of you who have joined by computer, you will notice a Q&A box in the center lower portion of your screen. Please feel free to write your questions there, and the moderator will receive those questions to be added to the queue for the Q&A portion at the end of the webinar. So you know, all questions will be anonymous. We'll get to as many questions as we can. And with that, I will now turn this over to our host for today's call, Arthur Bavelas.
Hi, everybody. Can you hear me? Thank you for joining in. It's really instructive to me, and I'll share it with you what the genesis of the call is. I met with Jordan in New York on Monday when he was here, and I thought we were going to have an afternoon cocktail. What ended up happening is I learned from Gordon, who is on the front line, along with his colleagues, about what was really going on with coronavirus 19. And so he kindly offered, and after I asked, to share his thoughts about what's going on with COVID-19. And it was a sobering discussion for me. The value, I think, in what you're going to find here is that you've got people on the front line who are taking care of, independent of what's going on with COVID-19, your peers. And so, not unlike a lot of other things, hearing from the people that are in the trenches and doing it day in, day out is super valuable and arguably is the best information that we can get. The other thing, and this will embarrass Jordan, we met at a dinner with some of the smartest people in the world, And because most of those other people aren't on the call, I can say Jordan was the smartest one. So consider ourselves all very fortunate. Jordan, if you can hear me, you're on.
Thank you, Arthur. Can you hear me?
I can.
Okay, great. So thank you, Arthur, for the introduction. I'm humbled. I'm just a regular small town doctor, Marin County, California. But so listen, everybody. Thank you. Good morning. Thank you for joining this really important this webinar in this really important time. I'm Jordan Schlane, the founder of Private Medical, and just at the highest level, our mission as a medical practice is to focus on long-term preventative health, truth in science, and an ethical integrity in everything that we do. Given the nature of the people we take care of in our global expert network, we have been paying close attention to the COVID-19 pandemic since early January, if not December. I am personally in touch with physicians in Italy, Seattle, China, South Korea, epidemiologists, immunologists, and data scientists from around the world in a group chat. And I'm getting about 20 to 50 updates from the world every hour. Most of you have heard from scientists and virologists and the lay press and financial analysts about market implications, but we're here today to share our perspective about the human, personal, and family implications of how to think about preparation in the context of a rapidly growing, once-in-a-lifetime pandemic, I guess I should say. We'll make sure to save time for some questions at the end. So if you can, save your questions and we'll get to them at the end. But just to be really clear, we're not giving personalized medical advice on this call. So we appreciate these are fluid times, and we hope this presentation is helpful. I want to introduce my partner who's sitting next to me here, Dr. Eric Swagel. He's the Chief Medical Officer of our practice. He's an internal medicine physician. And I also have on the phone Dr. Jennifer Pena, who's now working with our COVID rapid response team here. She's currently the medical director at Oscar Health. But more importantly, she was formerly the physician to the Vice President of the United States and a member of the White House Medical Unit, where she gave me a tour a few years ago. She led the coordination of the execution of medical planning for chemical, radiological, and biological threats to the White House during the Ebola epidemic of 2013 to 2016. So she will be able to help us, is helping us think about this and maybe able to answer some questions at the end. So leading off this talk, I'll turn it over to Dr. Eric Swagel.
Thank you, Jordan, and thanks, Arthur, for bringing everybody together. I'll give you a brief overview of what we're doing. Broken today's talk down into 4 broad sections. We're going to discuss the informational aspects of this pandemic, travel considerations, which we'll be able to go through briefly since that has been narrowed significantly. And in the meat of the presentation, and probably what you're most interested in, are aspects of medical care and preparation for the weeks and months ahead. As far as information goes, let's just quickly review the high-level situation summary. As of a few days ago, we had hit 95 countries that were reporting cases. At this point, the math is less relevant than the fact that it's a pandemic, and anywhere that hasn't been affected will soon be affected. Good news is that in China, as of today, they had the fewest new cases that they've had reported since January. So evidence that some aggressive measures worked, and that there is light at the end of the tunnel for the countries that are really in dark places right now. In the U.S., we're seeing cases in most states. There are numerous hot spots. By the time this presentation is over, any numbers I give you today will be stale. Testing, I can't say there's a lot of bright spots in that now. The dates we're hearing about widespread testing are about 2 weeks off before we can approach any scale like we're seeing done in Korea. There are a few bright spots in our locations where we have doctors and we are following things closely. I can say that some counties and some institutions like medical centers have set up drive-by testing spots like we've seen in Korea, and hopefully the labs will be able to back those efforts up and begin processing tests at scale so that we can get the information we need. The update on mortality, there's been a lot of debates in the days and weeks running up to this talk about the mortality risk of people who get infected with COVID. And the main thing I want to say is that while the mortality is something that's important to consider, all this quibbling over small numbers distracts from the fact that any of the estimates will result on a tremendous toll on our medical system and loss of life. And really what we need to be focused on are the numbers of people who are going to be severely ill or critically ill and require ICU beds, because those are the demands. Those are the surge issues that are going to be tough to accommodate and really reflect the expected damage on our medical system and society at large. So as far as information goes, remember, there's no asymmetry of information with this current outbreak. Everyone has access to innumerable Twitter feeds, real life dashboards giving us case counters. What there isn't is asymmetry of, and what you can make a difference with is your level of preparedness. Make sure you understand where you're getting your information from. I'm seeing all the email feeds, including some recent hoax feeds that you're getting. And I would weight the information that you receive differently. Google, of course, can be a way to find very reliable sources, but it can also lead you down rabbit holes. There's a lot of hysteria out there, and there's a lot of just dubious information. Ask yourself whenever you're talking to somebody, are you getting cocktail party advice, or are you getting counsel from someone who's actually responsible for your health? I urge all of you to again, weight your sources appropriately so that your preparedness is based on the best information and someone who has your values in mind. Your neighbor's top 5 things to do may not be your top 5 things to do. Make sure that you're getting information from people and places that have similar values to you, and that you're individualizing your decisions. So just to summarize, remember that this is unprecedented, and even the talking heads on CNN or Fox or whatever your news sources are, they haven't seen this before. So make sure that you're coloring their impressions with the fact that they're looking backwards in history or taking best guesses at the future. Identify your trusted sources of information and who's going to help you analyze that information and make decisions that work for you and your family. And early on, hopefully you've done this already, get in touch with your medical team and understand their availability, their perspective on the epidemic, and how they aim to continue to provide you with advice during this time. Travel. In typical epidemics and other political unrest, we can rely on the State Department and the CDC for ideas. In my estimation, they've been a little slow to issue travel advisories. An example of this was that a few days before we stopped air traffic from Iran, members of Iran's parliament had announced that they were infected. That epidemic, or I should say that flashpoint of this epidemic has proceeded to be one of the largest sites of cases in the world. As of now, travel is severely restricted inbound to the US, and some countries are difficult to travel to. Still, it's important to consider the risks that remain at hand. It's not just that travel exposes you to large crowds and a greater chance of being exposed to COVID-19. Remember, before you make any plans to travel and accept these risks, that you're considering hotel or ship quarantines. We've all seen how those can turn out. You're also subjecting yourself to possible ports of entry screening and being held up at various places, particularly if travel rules change while you're in transit. And then, of course, you have to consider the risk of medical care in foreign systems. All of our patients are provided with a medical evacuation service, but and even if you have those, know that they may be grounded in certain geographies based on local travel restrictions. So you want to know that ahead of time. And lastly, I urge anyone with children to consider the risk that you may become ill while you're expected to take care of that child. And a situation like that could become a very challenging childcare emergency far from your home. In summary, taking into account all those risks that we reviewed, do make sure that you have medical evacuation insurance, either as part of another financial product you have, and understand its benefits and exclusions. It may not work as well as it usually does. There are a few things you can do to reduce your relative risk if you must fly or if you've decided that you want to accept the risks of travel. Flying private and using smaller scale accommodations might limit your exposure to some of the risks we discussed. On to medical care. The broad goals of medical care during a crisis are to avoid needing to seek care from an overburdened medical system, making sure you understand in advance how you're going to get medical advice and treatment, both related to the epidemic as well as to your baseline medical conditions. And then, of course, the hottest topic of all for everyone, and the one we have the least specific information about, is how you're going to care for yourself around COVID-19 and other lookalike respiratory illnesses. So at our practice, we've organized our approach to medical care during this pandemic around different tiers. Tier 1 is the goal of making sure that you maintain access to your routine care without having to access the burden system. Make sure you speak to your doctor now. I mentioned that, and I think I'll mention it a couple other times during this talk. Understanding where they're at, how they're protecting themselves, and how they're making sure you can reach them is critical. Evaluate your telehealth options. These may be available through your insurer, and there are private companies that engage in telehealth and give you access to physicians. Lastly, an item you might consider looking into if your practice supports it is TytoCare. I mentioned this in particular because many of our physicians do use it. It enables people to transmit live images of elements of a physical exam, such as a mother helping a doctor who's remote visualize her child's throat so the decisions can be made with actual physician insights. You're going to need to make sure that you have supplies of your own prescription medications. Those of you who haven't undertaken efforts to get a month, or depending on the medication in your situation, several months of extra supply, that's worth doing now. You want to make sure that if you have essential care going on, like dialysis or chemotherapy that you don't want to interrupt, that your medical center has a solution for you to not miss a session. Lastly, you can anticipate common conditions and prepare for them. So providing a selection of antibiotics that cover typical common infections like urinary tract infections, gastrointestinal or respiratory infections, skin infections, that can be anticipated and done ahead of time. Supplies of common things like ibuprofen, Tylenol, and other medicine cabinet prescriptions, or over-the-counter medicines rather, can be obtained. And then medicines for common conditions like allergies, nausea, vomiting, diarrhea. Those are all things worth keeping on hand in case you're not venturing out of the house or supply chains are interrupted. Tier 2 during this crisis involves making sure that you're going to be able to be evaluated for symptoms that could represent COVID and not have to wait online in a busy ER where you might be exposed to the thing you're worried that you have, or other conditions. Medical home visits are offered by some physicians and some medical systems. Many of you are aware of or already engaged with private or concierge medical care. And in the future, hopefully, local providers will set up drive-throughs for more rapid testing at scale. And in some communities, there may be public health interventions like door-to-door visits to check on people, whether they're isolated or are asked to stay at home prior to being evaluated. Tier 3 is for patients who have been diagnosed with COVID-19 and are well enough that they can get their care at home. Remember that most patients with COVID-19 will not need hospital care. It will be important to have in place a system for effective quarantine of people who are possibly exposed and don't want to expose others until they know that they're not ill with COVID, and isolation of people who are fighting the disease and require care of family members, but have to do that safely. So physician advice is going to be important in these settings. Family members need to be adequately trained and supportive. In certain settings, they may need personal protective equipment and training in how to use it. It's not straightforward. And nursing support may be appropriate where available and to help family members take care of someone who's sick. Lastly, some of the medications that may be appropriate for mild COVID-19 disease, if available, can be administered at home through an oral route, and being able to have access and direction for those is critical. Tier 4 represents a turning point in the care of someone with COVID-19. That is when someone's condition worsens and you need decision support in making the difficult decision to bring them to a hospital that you've up to this point been trying to avoid. With proper oversight and good judgment, there may be situations where extending the at-home capabilities to safely avoid hospitalization is appropriate. This can be quite precarious, but additional nursing and surveillance, supplemental oxygen, IV fluids, and medications can all be part of that plan. This is speculative and I think very situationally dependent. I'm going to pause here at preparation.
Damien, did you want to jump in?
Yes, I just want to say that a number of people have joined since we started the call. For those of you who might have joined by computer, please go to the center portion of your screen, lower portion. There's a Q&A button. Feel free to ask your question or write your question there. And at the end, we will do our best to make sure all those questions get answered. Okay? Thank you much. And with that, Eric, Dr. Swiggle, back over to you.
Great. So we break our preparation section into 4 subsections. We're going to discuss prevention, protection, I lost my slide. There we go. Social distancing, and then we'll classify all these potential activities by their utility. An ounce of prevention really is worth a pound of cure here. We're waiting for a vaccine for COVID-19. There's some early action there, vaccines that are in phase 1 trials but won't be available to meaningfully impact this epidemic for at least an estimate of 12 months. So in the meantime, making sure your own immune system is as strong as possible, getting good sleep. We estimate that 7 to 9 hours is optimal for immune function. Maintaining a healthy diet. Some people support the idea of supplements. Vitamin D is one. That's some evidence behind it. And it's important to be consistent and get guidance on any of that. Also, managing look-alike illnesses or other illnesses that could bring you to medical attention for COVID, even though they aren't. So for instance, influenza, you can get vaccinated for influenza and avoid getting a respiratory illness that requires you to be evaluated for COVID. And also just steering clear of medical care generally is another benefit of your flu vaccine. Masks and other personal protective equipment have received a lot of attention, and I think everyone knows now that the main value here, the main approach to prevention here is in hand washing, avoiding touching your face and mouth, and that the real value of masks are in healthcare settings, not in people walking around their community. I thought this photo was a good one to illustrate the challenges of communicating and utilizing mask use. This was in the New York Times, and the caption read that this physician was providing a training session on proper use of personal protective equipment. It's worth noting that this training session includes both he and the model patient wearing what are surgical masks that do not protect from respiratory droplets or airborne precautions. These are surgical masks, which may have a little bit of value, but they're not the N95 respirators that are in such short supply. He should be wearing an N95 respirator, and she, as a patient, should be as well. But people outside that building don't need an N95 respirator mask, and they won't get much value beyond the reminder not to touch their face from the type of mask that these two people are wearing. Care of COVID-19 patients at home may benefit from having access to N95 respirator masks and other protective equipment like the doctor in this picture is wearing. It's worth thinking about if someone in your household gets ill, do you have a room to isolate them in with access to their own bathroom where meals can be brought to them and safely taken away, but they won't have to circulate among other family members if they're sick and contagious. Lastly, and as a point of emphasis, both for improved immunity, reduced face touching, and passage of secretions, and overall health, if you are a tobacco or marijuana smoker, now is the time to be motivated to quit. Clearly, some of the worst outcomes in the cases in China and elsewhere do involve people with smoking histories. So if you need extra motivation, you've got it. Let's talk about social distancing, which finally has seemed to taken on, at least in the communities where our practices are. The idea of social distancing is to take the fuel out of an epidemic. Remember that we all are the conduits of disease spread. So the point of social distancing is not just to avoid yourself getting ill. It's to take yourself out of the mix as a transmitter of disease. And in so doing, reduce the number of people in a community who are sick at once. So that is critical, again, because it reduces the burden on our healthcare system, allows fewer people not only to be seeking healthcare, but more people to be healthy and help operate the important machinery of society. And it buys time for vaccine treatment and development. So anyone who doesn't get sick now, but gets sick in 12 months, is more likely to have the benefit of an improved understanding of what the treatment options are, and perhaps have the benefit of a vaccine when it becomes available to protect them. This concept has been, I think, accurately described as flattening the curve so that we don't see a huge disease spike that overwhelms the healthcare system, that overwhelms our ability to keep the trains running, but rather flatten that curve, spread some of those illnesses out over a longer time period so that people getting sick later in the epidemic are going to have better care and perhaps even a shot at prevention through vaccines. There are practical considerations. So remember that social distancing doesn't have to be absolute. Certainly one can lock themselves in their basement, and if you don't interact with anyone else, there's no chance of you getting exposed to the illness. But any action you take to reduce the probability of exposure and the probability that you participate in a stream of transmission is important. So avoiding work and school, in some cases this is becoming mandatory. Avoiding large public events. Again, the NBA canceling their season is taking one of those options away. But even something as simple as shopping off hours. If you do have to go to the store for provisions, you can choose to do that at a time when you'll encounter fewer people touching boxes and other items. You'll reduce your own risk and your risk to society. Make sure that at your home or wherever you're sequestering yourself, you have adequate food, supplies, and we discussed medications. Make sure that those places are ready to receive you, that any deferred home maintenance get done, and that if you have complicated systems that you're operating, which you don't want to be calling people in to repair or to manage for you, that you know how to use them. As far as household staff goes, Remember that people who are working in your household represent an exposure risk and potentially an exposure to all of their exposures. So make sure that those people understand what you're doing with social distancing, that they understand the values of hand washing and other hygiene efforts, that they understand that if they're sick, you'll continue to support them financially in their job so that they can stay home and not feel obligated to work despite their illness. It's important to set up those expectations ahead of time. Other things to set up ahead of time, make sure that you can work from home. If you're not already set up to do that, get your office organized around that goal. Make sure you have options for recreation and exercise, whether it's a treadmill, puzzles, games. Make sure your internet's working. Consider, if you have the availability of a less populated setting, consider what the healthcare would be like and what isolation would be like in a country or mountain home. Some of those hospital settings, though they generally might be less desirable than the settings in a large city, they may be at lower risk of an intense outbreak. And perhaps those would be better places to seek care if they're set up to receive you. Some people with larger properties have the option of including others in their social distancing. Including healthy people and family members might allow for less of a social impact during the period that you're spending time away, and I think that's worth considering. Lastly, we all have pets and other animals that are really important to us. They need extra food, any medications that they may take, and space to be included in your isolation, and they can also, of course, lessen the psychological and social challenges of this period. I'm going to group the things we discussed into relative categories of utility, so you all can consider where you want to put your efforts for the biggest output. Some things that are unlikely to be beneficial is stockpiling medications for COVID-19. That's going to be very difficult to acquire these. Of course, there's going to be cost to society if these medicines become unavailable for others who need treatment. And right now, it's a bit early to predict what's going to be the best therapeutic option. Protective equipment might be valuable for people when they're caring for sick ones, but again, that's probably a bit much to try to stockpile. I would instead rely on your healthcare system to help you with those supplies if a family member is sick and it's appropriate that you use protective equipment while you're caring for the family member. Attempts to procure experimental antiviral medications that are being reported on widely are going to be very time consuming and I believe have a zero chance of success. And lastly, specific items that you might find in an intensive care unit like ventilators will not be useful in a home setting. They involve much more expertise and support from labs, respiratory technicians, and other players in a hospital setting to be actually valuable at home. In certain circumstances, I mentioned personal protective equipment might be helpful in caring for sick family members. And then there are some items that could be useful in these settings that are on the more expensive side. So a portable HEPA filtration unit to protect family members if someone is in isolation. These are large, sort of small refrigerator-sized units that can filter air and reduce the chance of spread when you're isolating a sick patient at home. Pulse oximeters can be ordered without a prescription. They measure the oxygenation of your blood and can provide useful information to a doctor who's caring for you by telehealth or to someone who's helping you make the decision when it's necessary to seek a more intensive level of care. Oxygen concentrators probably don't have much of a role outside of non-COVID related disease. So if someone's an asthmatic, is having a mild asthma attack, and it's deemed appropriate to give them additional oxygen so they can avoid an emergency room, that's a setting that might be appropriate. It is pretty clear that when patients with COVID-19 begin to need extra oxygen, they need to get aggressive care in the near term. So we wouldn't want to delay someone's transition to a hospital setting when we think that's inevitable. A nebulizer is, again, a very commonly used home device for people with asthma. It allows for medications to be aerosolized and inhaled, mainly in the setting of asthma attacks or for delivery of anti-inflammatory medications, particularly with children. Things that are definitely useful. We mentioned optimizing your current health status. Sometimes all that will take is a call with your doctor or a review of the medicines that you should be on. Get in touch with that doctor, understand what will be available to you as far as medical care and access. Consider telehealth. Stock your medicine cabinet with routine over-the-counter medications, prescription medications that may be useful, and of course, your own medications that you use on a regular basis. Ditto basic medical equipment like a thermometer or possibly the pulse oximeter that we mentioned. Those are things you can acquire ahead of time. We've talked about hand washing, wipes for commonly touched surfaces in your house. Those are all things that you should be stocking up on, along with food and household supplies in case supply chains are disrupted or you're aggressively socially distancing. Having those things on hand will help you stay safe. And lastly, making sure that if you have space where sick family members can be isolated, that you're set up to succeed there. Everyone's feeling uniquely vulnerable now. Again, this is really unprecedented, and those of us with a tremendous amount of control over our lives and our future are feeling quite challenged. So I urge you to channel that anxiety and that vulnerability into your efforts at preparation. Make choices that make sense for your family and plan on seeing this on the other side. Thank you.
Thank you, Eric. I don't have visibility on Q&A. So we're about to pull up some questions that you may have asked. Hold on one second. In the meantime, so Eric, so some of the questions are: should I donate money to my local healthcare institution?
Yeah, I mean, I think that's a great way to be of value. I can't speak specifically to individual institutions or how they're set up to receive these type of donations, but if there is a way to support their need of nursing, physicians, or items like ventilators, certainly that's a positive impact.
Great. Another question is, could you please address the lack of access to testing? And should you get tested, and when you should get tested?
So that's a complex question. I think the issues around testing are multiple. The federal government initially planned to have a typical approval process for outside institutions and private labs, commercial labs to test. And the federal government had issues with their initial tests getting shipped out in sufficient quantities, getting produced in sufficient quantities. And now I think what we're faced with reflects that, like a supply of materials, but also operational issues that seem to be slowing the rate of testing. That's severely limited doctors' understanding of the epidemic, doctors' ability to develop a case definition, that is sort of what does COVID look like in its earliest stages, because it overlaps tremendously with common conditions like the cold and influenza. And so right now, I think it's fair to say, and I know there's new news out today, but I think it's fair to say that we're in limbo. The FDA did just approve a new technology, a rapid test from Roche Labs. I don't know when that's going to be available. My understanding is that the current platforms for testing are expected not to be available at scale, meaning even on the order of, say, 10,000 tests nationally per day or even per week. That's not going to be happening until March 24th was the date that I heard. All that is fluid, of course, and there are individual institutions that are ramping up their own testing capacity. There's a story on today's wire that I saw that in one of our communities, Los Angeles, UCLA has developed and gotten approval for their own test, and they'll be offering a 24-hour turnaround. Again, the volume that they can do that at is uncertain to me at this point, but we'll see over time.
Excellent. And this is a question for Dr. Jennifer Pena. What are the most significant areas of unmet need that we are not addressing in current and future plans?
Yes, hi, can you all hear me?
Yep.
Oh, excellent. Thank you so much, Jordan, and thank you for the invitation to participate. So to address this question, the first areas that I would identify as unmet need currently and for current response is really the burden to the healthcare system. The projection of numbers are overwhelming in terms of the need that we could potentially have, not just for regular inpatient hospitalization, but especially for higher level of care, mainly ICU and critical care. And so if we're able to control the continued spread, even if we were able to control it, we would still potentially face a situation in which we're going to overwhelm our hospital systems. And so I think that would be my biggest concern at this particular point, even more so than a lack of testing. Really is just being able to take care of those folks when they present critically ill into the hospital. And I believe the next thing is future plans. I would say is really identifying the critical needs when it comes to, say, things like testing and research and development in terms of these pathogens, right? Coronavirus is not a new virus. It is very similar to what you all might remember as SARS and MERS, same class of virus. And we've dealt with similar, not to this degree, but obviously outbreaks in the past. And so we really have to incentivize our R&D when it comes to researching these pathogens that have and are likely to continue to cause epidemics. And so those would be, the two key factors in terms of current and future that I would identify as unmet.
Thank you, Jennifer. There's another question here, which is somewhat specific, but can you please go over the basics of how the virus is transmitted? Clearly by air, but how about through sweat as I play hoops, pickup hoops, and want to continue playing? Jennifer, you want to take that one?
Sure, absolutely. That's an excellent question. It comes up a lot in terms of different, ways to transmit the virus. Currently, as Jordan mentioned, right, so droplet, anything from the respiratory system is what is the most common mode of transmission. There has also been identified fecal oral, so also in the stool samples, there has been virus identified there in patients that have been positive for the virus. Not in sweat, so we don't have to worry about that at this particular point. I think the consideration there is if you are going to the gym or you're going to play basketball in a setting where you're exposed to people in close proximity, that's really the biggest issue, is trying to maintain, as Dr. Swagel mentioned, that social distancing. Obviously, gyms and areas of working out can be crowded. There have been questions also posed about transmission to fetuses and women who have delivered babies who have been, the women have been infected with the COVID. To my knowledge, and please correct me if I'm wrong, Dr. Schlegel and Dr. Schlein, I have not seen any cases of transmission from mother to fetus that have been identified at this particular point. And those have been the most common modes of transmission that people are inquiring about. So again, droplet, respiratory droplet, and fecal oral at this point.
Great, thank you for that, Jennifer. I think it's worth, just as a brief comment, and it was something that Dr. Swagel brought up earlier, was about, have you reached out to your medical team and do you know what their preparation is? We're entering a phase of testing is going to be bottlenecked. That is happening, and it will continue to happen until our country gets their stuff together. However, the phase that we're entering into is really the psychological phase of acknowledging that a lot of people are going to get this that we know, and we all have a really big loss aversion. It's a bias that humans have, but the truth is 80% of us are going to be just fine when we get it. And so, the way we think about it here at Private Medical is we make ourselves available to our families and our people to walk them through on a regular basis. So I do think it's important to start to shore up your communication with your healthcare team and find a telemedicine outlet if you have an insurance company that offers telemedicine. And I don't know, Jennifer, and this is not a plug for Oscar, if they offer telemedicine options or not. But that is one quick way to have a relatively high touch virtual, a person to give you some guidance as this goes down the pike.
Absolutely, and no disclaimer here, no official business for Oscar on this talk here. But as an insurance company, of course, we offer telemedicine to our members, and I know for a fact that many other insurances also have similar capabilities. At this particular point, we're urging our members to utilize our doctor on call services for virtual care primarily before trying to go into the doctor as much as possible. Again, to try to control the spread of infection. So I would urge you all to consider that option first if you have any concerns or questions for your providers.
Okay, and I don't see any additional questions, so I want to just thank you all, Arthur, for putting this together. We, of course, over here in this medical practice are very busy trying to understand what's next. I just looked at the newspaper. As you probably will see, Trump just declared a national emergency. Going back to the travel slides, there is a high possibility that states will be locked down and there will be travel restrictions across the country. So if you are traveling, if you're traveling, if you're somewhere else right now and you want to get home, I would start making those plans sooner than later. And with that, we'll say goodbye. We got to get back to work. And this will be recorded. We ask that if you want, to please share this with discretion. We are a private practice, and we are generally shy away from the large public view. There's one last question that came in, which is, and I'll do this and then we'll close. Is there any evidence to suggest that after contracting coronavirus, either on an individual or population level, that reinfection becomes any less likely? Jennifer, you want to try that one?
Yeah, sure. So that actually has been on the news a fair amount as well. And two things. So obviously, for most of these conditions and viral infections, having had the infection, if you're able to overcome it, you will confer some sort of immunity to it. The concern with this, of course, is we don't know enough about the virus yet to know how infectious it could be in future instances of exposure. Also, being the type of virus, RNA virus, it likes to mutate rapidly, just like the flu virus does. And so even if we were infected with one particular strain and overcame it, you could potentially still, yes, be infected again, say if it's a different strain of the same virus. And so this is a plug for vaccination. If we're able eventually to come up with some sort of vaccine, I urge everybody to consider getting that, because it will confer you at least some immune protection to the vaccine does every season.
Great. Well, with that, we're gonna have to close it. We got to get back to work and tend to some people. But thank you very much. Have a wonderful weekend to the best that you can. And I would take this presentation very seriously and start to prepare to hunker down. Thank you all.